slight one.
Okay.
I mean, I took medication for it today already, so it's, I mean, it's still, I mean, it's, the worst of it is gone, but there's still like after stuff that hangs around. I don't even know how to explain it.
Okay, so let me ask you this. On a scale of 1 to 10, before you took your medication today, what was the pain? And then now, what is it now on that same scale of 1 to 10?
It was probably about a 7 before I took the
What
medication.
would you rate that now, if you could rate it?
It's probably like a 4.
Okay, a 4 is pretty significant. That's kind of like, it's still kind of painful, but somebody on medications.
And I get a lot of nausea with them too, which I do have right now.
Okay.
So
I want you to just hold the glutathione patch right here in this hand. So hold this one right here, and hold that a little higher up to make it clear. And I'm going to stick this here, and just tell me if you feel any changes. Does that number go down? Do you feel any other change at all?
it helps with the nausea actually.
Okay. This is what glutathione does. It starts to detox the body, and it's a cool thing. It seems strange to just put something right on the body and then immediately have a reaction to it. This is what makes this technology so cool. What are you feeling? Give me some feedback.
I don't know, it kind of feels tingly a little bit.
Okay. How's the migraine symptoms? Has that changed at all? Is it still 4?
It's still kind of there.
Okay. So where would you point the migraine pain right now?
It's always in the front.
Right on the front, like right here in the front? Okay. I'm just going to put this white patch right here. And then tell me if that changed anything. Okay. So then I'm going to stick this one right over the top of it, right over the top of your head. Not stick it to your hair too much. Tell me if that changed as well.
It's like a little bit less, but no,
Okay.
it's not totally gone.
That's okay. So here's what it does. So the brochure says stick a patch here and one above it at 12 o'clock. And normally they say put a brown one right there on the point of the pain and a white one above it. But this is something she's talking about that's kind of chronic old pain. So then I'm thinking, all right, let's try the white patch first and do the brown one above it. So they say if it's old chronic pain, use the white patch first and start with the brown going around it. And if it's an acute kind of new pain, start with the brown and do the white one around it. And this is explained in the brochures somewhat. So let me just ask you that. It's still like what number though? 4, 1, 2, 3? What would you rate it? That tells me how to move these in direction. That helps.
It's probably more like a 2.
Okay, so we cut it in half. So that's pretty cool.
Yeah.
That's fast. I like that. So I'm just going to go to this point here and just see if that changes it at all. Same, better, worse.
I think it's getting worse. It was better.
That's the wrong direction. Then.
Yeah.
That's why we go, let's go the other way then. Let's try that. And as you can see, non-transdermal, nothing going in. So it's just signaling the body. Different?
I think it's worse.
Okay,
It
so
was
that's
better
not
on the
cool.
top. Yeah.
So I want to try something go right to the back side, like an arrow kind of going through, and see if that makes it different. And each person, okay, like what number was rated?
Well, it's probably still like a 2.
Still like a 2.
Yeah.
Okay, we just got back to what it was. Okay, so here's the thing. The patches work different on everybody. And you can keep moving them around and probably get it down to 0. Okay? But for demonstration purposes, I like to just show how fast it works and how from a 4 to a 2 is kind of cool. And should you live with that right now?
No, no.
I mean, I usually live with a...
She usually lives with a higher number.
Yeah.
And so now I could ask you, did you drink any water when you came in? Okay, because a lot of times when I'm not getting results with the patches, I hand them a bottle of water and say, chug this down and then let's talk. And we start over. Because the body has to work with hydration. The body's made of water, and this is how these patches work even better. So when we find the best placement, then we take the backs off and literally stick them on, kind of like a Band-Aid. But in her case, this is the best place to do that. So what we do is send you home and say stick them on like here, and then kind of see what it does for the next while you sleep. So
Right.
okay. So how do you feel right now? Any other symptoms disappear?
The stomach.
The
That went
stomach
away right away,
digestive
yeah.
problems or the
Mhm.
queasiness,
Mhm.
and is that pretty significant too?
Yeah.
To that?
Yeah.
On a scale of 1 to 10, what would that have been
Uh,
before we did that?
That's been like probably like an 8.
Okay,
And
that's
that went
fine.
away, yeah. So,
Pretty cool.
Yeah.
That's what we like.
That's pretty crazy. Yeah.
Okay, so what I'm going to do is take these back, and I'm going to demonstrate them on someone else.
Okay.
And then afterwards, we'll talk to you a little bit about how
Alright.
you can get these things. Get yourself all taken care of. I'm sorry.
No problem.
Okay.
Thanks.
Thanks for coming up. They were great. Anybody else want to try these?